If you want to know if you should stop treatment for your 84-year-old dad with hypoxic brain injury after cardiac arrest, stay tuned. I've got news for you. My name is Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. Today, I have an email from Shani, and he says, the ICU team wants us to stop treatment for my 84-year-old dad with hypoxic brain injury due to cardiac arrest. What should we do? So here is what I advise Shani in a situation like that. First thing is, doesn't really matter what the intensive care team wants. You have rights. Now, intensive care teams are very good to pretend they can do whatever they want, including taking someone's life if they feel like it. But that's just a pretend, right? I mean, I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years, and where I've been consulting and advocating for families in intensive care since 2013 here at intensivecarehotline.com. And I can very confidently say that we have saved many lives as part of our consulting and advocacy here at intensivecarehotline.com. And you can verify that if you go to intensivecarehotline.com, if you have a look on our testimonial section, and if you have a look on our intensivecarehotline.com podcast, where we've done client interviews and our clients have written on our testimonial section, and you can see for yourself that we've saved many lives for our clients in intensive care with our consulting and advocacy. Now, here's the thing, Shani. If you agree to a withdrawal of treatment, you know the outcome. Okay? If you don't agree to a withdrawal of treatment, you don't know the outcome. All right? But if you don't agree to a withdrawal of treatment, you give your dad a chance. Now, I know your next question is, how high are his chances? How high are my dad's chances to survive and go back to a normal or a quality of life that he is happy with? Very difficult questions to answer. We would need to look at medical records. We would need to talk to doctors and nurses directly to give you that second opinion to find out what are your dad's chances. And at the moment, it would just be speculation. My other advice in a situation like that is that you should make decisions that you do not regret in 12 months' time. Do make decisions today that you don't regret in 12 months' time, right? Because I'll tell you why. When families are in situations like that, and they make hasty decisions and they agree to withdrawal of treatment and all the rest of it, and they might regret that. Then they come back 12 months later and they have second thoughts, and they think, oh, if I had only not agreed to a withdrawal of treatment, right? That is what they think, right? And then it's too late. So, for example, if you continue treatment for your dad, right, and he's on a breathing tube, he's on a ventilator, but he's not waking up, maybe a tracheostomy is the next step, so that you can wean him off all sedation, that it's more comfortable for him to be on a ventilator, and then start weaning him off the ventilator slowly. I'll give you a tangible example here. Currently, we are working with a client who's in a similar situation. Now, the client is 80 years of age, very similar situation. The ICU wanted to withdraw treatment. The family objected, right? The ICU said, well, your dad won't survive. The ICU said, well, if your dad is going to survive, he won't have any quality of life, right? Now, 3-4 weeks later, now he's got a tracheostomy and he's weaning off the ventilator, right? And he's slowly, and I will say this slowly, I'm not making up things that are not true, and he's very slowly waking up, very slowly, at his own pace. Now, the goal here is that maybe your dad will come to a point where he can make his own decisions. How good would that be? You don't want intensive care teams making decisions for your dad, or for you, for that matter. You would want to come to a point where your dad can tell you, yep, I'm happy with the tracheostomy, I'm not happy with the tracheostomy, I want to live, I want to die. The bottom line is there's plenty of time to talk about end of life in ICU. Plenty of time, right? Plenty of time to talk about end of life. What's the hurry? to kill someone in ICU? Please tell me, what's the hurry? Now, most research suggests that 90% of intensive care patients survive. So why would your dad not survive if the odds are in your dad's favor, right? Also, the longer your dad stays ventilated with a breathing tube, the higher the chances he'll catch an infection, the higher the chances he'll end up with a ventilator-associated pneumonia, the higher the chances he'll end up with a UTI, with the sepsis. The sooner things can be normalized, the sooner you can have a tracheostomy and get back to normality, can get mobilized, can have physical therapy, can have some level of stimulation, the quicker you will actually find out what your dad is capable of. The sooner tracheostomy is done, your dad should be completely off sedation. Now, your dad might be off sedation already now. We don't know. You haven't mentioned that. But, the biggest challenge for families in intensive care is simply that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. Right? And that is exactly what you are currently dealing with. Right? And we have helped hundreds and hundreds of members and clients over the years to improve their lives instantly when they have a loved one in intensive care, which includes saving their loved one's lives. And once again, you can verify that on our testimony section, and you can verify that on our intensivecarehotline.com podcast section where we've done client interviews. And I do one-on-one consulting and advocacy over the phone, Zoom, Skype, WhatsApp, whichever medium works best for you. I talk to you and your families directly, and I handhold you through this once-in-a-lifetime situation that you simply can't afford to get wrong. I also talk to doctors and nurses directly with you or on your behalf, and I ask all the questions that you haven't even considered asking but must be asked when you have a loved one critically ill in intensive care. And that's also why, and I also represent you in family meetings with intensive care teams so that you have professional representation in family meetings with intensive care teams. We also have a membership for families of critically ill patients in intensive care, and you can become a member if you go to intensivecarehotline.com. If you click on the membership link, or if you go to intensivecaresupport.org directly, in the membership you have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I have personally written and recorded. And all of the information and access to me and my team will help you to make informed decisions, have peace of mind, control, power, influence, so that your loved one gets best care and treatment always. We also do medical record reviews in real time. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share this video with your friends and families, and comment below what you want to see next, what questions and insights you have from this video. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification for the YouTube live if you are a subscriber of my YouTube channel, or if you are a subscriber of my intensivecarehotline.com email newsletter at intensivecarehotline.com. Thank you so much for watching. This is Patrick Hotzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.